Good afternoon. As you all know, I'm Bob, and I'm here today to talk about concept maps and using a tool called SpiderScribe. We're going to start out with something fairly simple. I have a case study that I've grabbed some information on, and we'll kind of walk through this together, and hopefully you'll find some useful information in all of this. So first off, let's get our case study up here. We have a 35-year-old mother of two school-age boys who arrived by ambulance in the ED. She'd been in 6 hours earlier, actually, but she's back again with dyspnea and anxiety. And so we're going to talk about this lady and her situation. We've got some subjective data, basically talking about what happened to her earlier. She has a prior history of asthma for the last 2 years, but she actually doesn't have a regular PCP, and she doesn't normally take any medications. And then, of course, we've got some objective data as well. We've got, our physical exam, our assessment, some diagnostic studies, and we're going to talk about those in a moment. So let's go ahead and I need to close this one out, and we're going to create a new one. So let's see here. First, I'm going to browse on over to www.spiderscribe.net. And when you first bring this up, you'll see they have pricing and plans, and that's all good stuff. In fact, the thing you want to do is to go to see pricing and plans, and you don't actually have to pay anything. I do pay because I want some of the things that come with the paid subscription. But for you, you can go to a free personal plan, which is definitely a good idea. So you just need to give them your name, your email, your password, and if you like, use your Dominican email when you're done with the program, and your Dominican email goes away, so does your account. So you don't have to get a lot of information from these people you don't want. So I'm going to go ahead and log in. It does actually know who I am. And my screen, your screen will be empty. Mine's not empty because I get maps from all my students. So we're going to create a new map, and this is an asthma. Oh, come on, where's my mouse? There we go. And this is actually my third pass here for various and sundry reasons. So we will, and you can add a description if that makes sense to you. I don't need it. My titles are descriptive enough, at least normally. So we create a map. There are some tools up here. There's a magnifying glass, which you can use to change, you can zoom in or zoom out if you have a map that's bigger than you want. You can print your maps, or you can, you can also export them to, let's cancel that. I didn't actually I didn't have anything there to download. But you can export to a JPEG or, portable network graphics, a PNG file. Actually, the portable network graphics seem to work better. And what's this? Oh, we're not going to play with that. So the heck with that. And if you need to delete stuff, you can certainly, select something, delete it. Okay. SpiderScribe supports text boxes, Word documents, images, maps, and calendars. All very handy. However, the only thing we really need is a text box. So I'm going to put this in the middle here. I'm going to go grab some information, the information that's relevant to our situation here. So we have our lady here. I'm going to double click and get back in there. I'm going to paste some information so you don't have to deal with the painful aspect of watching me type. Okay, so we have a 35-year-old female brought in by ambulance for severe wheezing, dyspnea, and anxiety. She was seen in the ED prior to her current asthma attack for an earlier asthma attack. She was treated with an albuterol nebulizer to good effect and discharged home with her nebulizer. Now, while she was at home, she began experiencing symptoms again. Okay, I want to add a new line here, so I'm going to hold down the Shift key and press Enter. In fact, I'm going to do it twice. If you just hit the Enter key, it will close the text box on you, and then it looks like this, which you can't do any data entry, so I have to double click, get back in there. All right, so at home, began feeling short of breath again. Self-treated with the inhaler several times. Then she called for emergency services. Oh, that would be an M, not an S. There we go. Okay. So this is relevant. We're going to talk about his shortness of breath and her self-treating and some of the impacts here. So let's see. I want to add a little bit more here. Let's talk about her history. That is, if I can grab the stuff I need. Okay. So we're going to add another line, another text box up here. All right, history. And I'm just going to paste in what I grabbed earlier. No, go away. There we are. 2-year prior history of asthma, currently on no medications, and no PCP. So let's do one of the things the reason that we're using SpiderScribe here is to say, I want to show a relationship between these two. Her prior history is relevant to why she's here. She has a history of asthma. So what else do I want to add to this? Well, let's add her assessment information. I don't know if this came from the chart or if it's, the nurse, it's you, the nurse, that's doing the assessment, but we're going to plug this information in. So, yes, it's you. You walk in, the patient's sitting upright, she's using her accessory muscles to breathe, she's speaking in 1 to 3 word sentences. You do take her vitals, her temperature is 37, it's normal. Blood pressure is a little elevated at 135/90. Respiratory rate is definitely elevated at 34, and it's shallow. Her heart rate also very elevated, 126 beats per minute. And her O2 sat is a little low at 88% on room air. You hear audible wheezing, and as a result of your auscultation, you find that she has no breath sounds bilaterally in her lower lobes. And in her mental status, she's anxious and restless. And that we're going to talk a little bit more about that in a moment. What else? Well, we had some labs drawn while we were waiting to get other orders and figure out what we're doing. So let's add the labs. Okay. It said paste. There we go. All right. Oh, yeah. Okay. Well, okay. ABG is a little, and we have some diagnostic studies. We'll go ahead and add those in as well. And then we can talk about these two aspects. All right. So get this sort of lined up. And again, there's a relationship between our lab findings, our assessment findings, the diagnostic studies, and why she's here. So we'll just say, yeah, her symptoms have led to those vital signs and your observations and your assessment and diagnostic studies. So, okay, her ABG, she's a little alkalotic with a pH of 7.46. Yeah, she's, you noted earlier that her O2 sats were 88%, and ABG indicates that as well with a PaO2 of only 76 millimeters of mercury. Her bicarb is generally, it's basically in the normal range at 23 millimeters of mercury, and her PaCO2 is also normal at 36 millimeters of mercury. But O2-sat, 88%. CBC is basically within normal limits, nothing much going on there apparently. And the diagnostic studies, we have a chest x-ray that's been done, and she's demonstrating bilateral hyperinflation and bilateral lower lobe atelectasis, which ties in, connects with our findings here of audible wheezing, and this also supports as well what's going on. We can, if we do this, it'll make it a little more obvious. There we go. So those all seem to hang together. It kind of makes a certain amount of sense. I'll pull this over here a little bit, make some room. Cool. So let's talk about her situation for a moment here. When she was at home, she started feeling short of breath, and she started treating herself with that multi-dose inhaler. And you're not really supposed to use them time and time again because they can have side effects. What are the side effects? Well, with albuterol, side effects are increased heart rate. They can lead to a sense of restlessness, anxiety. So, oh yeah, she's got those too. However, there's another relevant fact here. When you talk about anxiety and restlessness, those are also classic early symptoms of hypoxia. And she seems to be, demonstrating she's a little hypoxic. Now, you may ask, gee, she's asthmatic, and, why is she alkalotic instead of acidotic? Because you would think that somebody who is suffering from a severe asthma attack, that they have an ineffective gas exchange, and you would expect the CO2 to be accumulating and leading to an acidosis due to the carbonic acid, from carbon dioxide dissolving into the blood and making carbonic acid, which is, what our brain actually senses is the acid level of the blood. However, in the early stages of a severe asthma attack, because of the increased respiratory rate, people tend to blow off their excess CO2 initially, even though they're, it's still not effectively exchanging gas. And that leads to the the CO2 level actually dropping. And her pH reflects that, even though she's still basically in CO2 levels are within normal. But she is getting a little alkalotic. Now, if she's left untreated, it will reverse itself, and she will get increasingly acidotic as she holds on to more and more CO2. Okay, so let's talk about what else is going on with her. She has IV established, which was in our other, in the case study situation. So she's got a 20 gauge in her left forearm, and in that 20 gauge, we're currently just running some normal saline at 100 an hour. And this is just, to make sure that we have a patent line if we need it. It's not that she's particularly dehydrated or necessarily needs fluids, but these are being, let's say, in order to run this, we need that. Actually, let's turn that around. So there we go. And this is being done as, it's prophylactic, but still it's just part of her current treatment. Oops. Not quite what I intended. It's usually pretty easy, but occasionally you do stuff and it doesn't quite catch where you're going. But let's talk about what's going on with this lady. I'm going to talk about nursing priorities, Because the goal of this tool is to allow you to organize your thinking and ultimately, develop the care plan you're going to turn in. So this is, you've collected in your handwritten notes perhaps something that looks like this. It's just, shorthand, talks about, the current factors. But now we need to actually start thinking about things that I consider really important in my patient care. And this is what I call nursing, well, I'm not the only one that calls them this. Okay, nursing priorities. So what are nursing priorities? From my perspective, it's what are you doing every time you walk into the room? What are you thinking about in the immediate? As my other students have heard time and time again, my attitude is, what's going to kill my patient in the next 8 hours? So let's think about this lady. What's she got going on that is immediately potentially life-threatening? Well, she's got problems with her airway. And her breathing. Oops. Okay. So, if you think about the classics, the ABCs, which are, things that are always in primary focus when you're taking in the NCLEX, airway and breathing right on the top. And this is what's going on with her. So what are my priorities regarding her airway and her breathing? Well, let's see. Every time I walk in the room, I'm going to be reassessing, her status as far as her breathing. Is she talking, her respiratory status? Sorry, guys. So, sentences. Is she still speaking in 1 to 3 word sentences, or is she down to 1 word or up to 10? Her color, of course. O2 SAT. I'm actually not listing these in the actual order of priority, but just, when I walk into the room, what's her mental status? Is her anxiety being relieved? Is she starting to demonstrate that she's getting better oxygenation? So, again, color, speaking, work of breathing. Let's add that. Well, that should be an O. So her work of breathing. Is she using those accessory muscles still? Those are the things that I'm going to be concerned about. Every time I walk in the room, I'll be, I'm going to talk to her and, hey, Ms. Jones, how you doing? And if she says, I'm doing really well and I'm feeling much better, there's 10 words. If she says, I'm having trouble breathing, and taking a catch breath between each of those words, that things are not getting better. Okay, so we have our priorities. And actually, you can use these priorities to help tie in with your nursing diagnosis. So let's go ahead and add a nursing diagnosis here. What's the obvious one? How about ineffective breathing? As evidenced by her O2 SAT, her work of breathing, anxiety and restlessness, okay, and what am I going to do about that? Oh, I don't care about that right now. Well, I do, but we'll come up with a plan later. Well, actually, that's what you'll come up with. So there's my first nursing diagnosis. And so this leads to that. And this, again, leads to this. So I'm going to manage her airway. I'm going to reassess every time I walk in the room. I'm going to talk to her, listen to her speaking, her color, her O2 sats. And this is, at this point, you really have enough to start building your care plan. Now, the care plan requires that you have two, count them. You need to have two nursing diagnoses. What could we actually add as a second diagnosis? Well, let's go back to our priorities here, because we've got an elevated heart rate. So what am I going to be concerned about? Well, we don't know that she has a cardiac history. Maybe she does, maybe she doesn't. But, you know, anytime you put extended stress on the heart, you know, the 120, 130 heart rate continuous, you know, if she's not in good shape, or if she hasn't been chasing her sons all over the neighborhood, you know, maybe she has a limited tolerance to exercise. We don't know. So I'm going to be looking for evidence of any kind of cardiac issues. So I'm going to be checking for, you know, chest pain. Dysrhythmias. And why am I going to check for dysrhythmias? Well, she's taking albuterol, and that, you know, that can actually lead to, you know, it could trigger if she's already, and if she's susceptible to AFib, she might suddenly find herself in AFib. And what happens then? Well, you know, her circulatory system drops off, you know, her blood flow. So she's, now we've got ineffective circulation. And so, you know, you could have a, you know, easily add a second nursing diagnosis here of, you know, she's at risk for. Now, you know, our first diagnosis, she's not at risk. She's experiencing this. So this is not a risk. She has an ineffective breathing pattern, at risk for reduced cardiac output. And I'm not going to extend on that, but that would be my expectation. So this is kind of, we're talking about the pathophysiology here. Well, actually, we didn't do that yet. Let's add our little bit of pathophysiology. That's something that should also be in here. So I should have added it earlier. It was in the back of my head, and I just went ahead and started talking about stuff. So let's talk about patho, at least at a, you know, simplistic level. If I could actually type. Yeah. All right. So what's the pathophysiology of asthma? It's an inflammatory response. And you get, you know, inflamed and constricted airways. Actually, it's often referred to as reactive airway disease. Well, it would help if I could spell too. Okay, what goes on? We talked a little bit about it, but basically, you know, we get a decreased gas exchange. Which ultimately leads to, you know, increased CO2, decreased O2, decreased pH due to the increased CO2, otherwise known as an increase in acidity. And it's that increase in acidity that drives our work, our desire to breathe. And of course, since we're not effectively exchanging gases, it's kind of a circle that gets worse. It's a feedback mechanism that makes things worse and worse. We try to breathe faster, which requires more work, which makes more CO2. And since we can't get rid of the CO2, it makes our blood more acid. And it's not a good experience, especially if any of you have asthma. You know how hard that is. And actually, I have this arrow backwards because really the patho is what leads to her situation. And what's going on here? So it's because of this that she's experiencing her labs, and also in part playing a role in her. And let's see if we can do that again. There we go. No, not there. Sometimes it doesn't go exactly where you want it to go. Okay, well, it has its own mind about this. But that's okay. So what have we got going here? All right. So the patho, of course, is what's also leading to, ultimately is leading to our priorities, which of course is leading to our nursing diagnoses. Okay, so that's a pretty simplistic pathophysiology. You could get certainly much more in depth on this. You could talk about cytokine release and all that good stuff that happens, but really we can keep it fairly simple. The purpose here is that you can explain to me, that you understand what's going on, and really, this is a concept map. You are, at this point, you have all the information you really need to build your care plan and, fill in the blanks on the meds and what their side effects are and what you expect to have happen. But really, in terms of your patient care, you also know what you're going to do every time you walk in the room. You're going to be assessing her breathing. And you're going to be maybe also keeping in mind her cardiac status. You're going to be looking for chest pain or dysrhythmias or anything that could indicate that, her heart is not tolerating. You're also going to be looking, if your treatments are effective, her heart rate should be dropping. And of course, her sentences should increase in length, and her color should improve, and her O2 sats should improve, all that stuff. So we're really done here. However, one of the things that's kind of nice about this tool that can be kind of handy, let's say I'm going to put all the assessment and diagnostic. I want to make it stand out a little more. So one thing I can do is I'll highlight that, and I can go over here and say, I want all my assessment data to be green. It's not easy being green. Kermit the Frog sang about that, but we don't have to worry about that. Okay. So actually it is fairly easy to, I picked the wrong color of green there, didn't I? A different shade of green. Let's go, there we go. We'll leave the history and stuff the way it is. Patho, well, let's see if we can find something that's kind of, let's go with kind of brown here. And, actually I'm going to change this. I would like to highlight things that I'm actually kind of concerned about. So really, her labs actually are concerning to me, and her diagnostic studies are also equally concerning. So I'm going to change this. There we go. So it's easy that you can change this. We'll say her treatments. We'll make those all some kind of blue here. So, this helps to make it a little easier to figure out what you're looking at when you're looking at things. What should we do with nursing priorities? Let's see. I know that some of these colors really don't view well, but we'll try that. Yeah, it's a little too close to red. Let's try this sort of orange up here. There we go. And maybe we consider the nursing diagnosis kind of the same way. All right. So at this point, I have a concept map. And if I wanted, if I want to change the magnification level, we can zoom out. More than likely, you're going to want to zoom in to see something. You can actually grab the whole screen and move it around as you need. That's this navigator over here. Pretty handy. But you can also just grab the background and move things around. You already know about changing colors. You could send it to a printer. You probably would want to select the visible area rather than the whole map. And you can say, should it be landscape? I think so. Anyway, I'm not going to print this at the moment. No need to. If you wanted to export it, if I were to export this, you can see it generates the map and save the file. And I'd have to go back and look and see where it saved my file. Oh, it's over here. So, it volunteers asthma concept map, and let's see, where am I going to put it? I'll put it in my pictures. I put it with PowerPoint slides. Well, it doesn't belong there. It doesn't. Actually, we're going to cancel this. It doesn't belong anywhere. But, you can pick wherever you want to put your stuff. We don't want AutoSnap. We don't care about that. So that really kind of covers, the use of SpiderScribe as well as the development of a concept map. And I think you all know how to develop a care plan. So we're going to go from there back to, kind of winding down the day. And I appreciate your time. And hopefully this has been a useful exercise. And we'll talk soon.